Hello, everyone. We're starting this afternoon, this good sunny afternoon, talking about some injectables. As the quarantine is getting closer to being over, 1.5 offices open. We're having a lot of requests for pent-up demand for patients that are looking for having injectables, and I want to take a few minutes to discuss different injectables that we have and some of the nuances and differences between them, and also talking about how some people are better candidates for one versus the other, and also really discussing some of the smaller differences between some of the injectables. We in the US have almost less than 20 injectables that are FDA approved for different uses, whereas different countries like in Europe and South America have things along the lines of about 40 to 45 different injectables available. So in a way, the stringent requirements that the FDA has for us to push injectables through the FDA process is good for consumers and actually good for practitioners as well, because there's a lot of Me Too type injectables out there that are not necessarily better than the next one. And it's and as you will see and I'll discuss, it's more about the art of the injector than the actual process and the product itself. So we'll talk about some of those smaller things as well. So a lot of what we do and a lot of what we patients request have to do with what other celebrities and what social media persona have had done. And you know, everybody equates Kylie Jenner, lips, nose, nasolabial folds, and obviously those are all things that we get as practitioner asked about all the time. Angelina Jolie's lips before Kylie Jenner were the most commonly asked injectable profile in our offices. Here you have Hailey, who, again, these are younger patients. They already have good anatomy, and the small, subtle differences without anybody really noticing unless you're on the spotlight is what injectables are all about. And you're not going to have big facelift type volumes, even though there's some things that we can do with that. For the most part, there are subtle, small differences, which is what's ideal about injectables. So first, I want to talk about neuromodulators, otherwise known as toxins. Toxins sound a little scary, but right now, FDA-approved neurotoxins are for injectables. Botox Cosmetic, which is the main contender in the neuromodulators market, they still have the largest market share, and in our practice, that's the majority of the injections we do is Botox. It's more than 15 years now FDA approved, and do remember FDA approval for on-label use for some of these products could just be the 11 lines, or they're not, even if we do crow's feet injections with them, that's considered an off-label, appropriate but off-label use of a neurotoxin like Botox. After Botox, we actually had Xeomin, which came on at this point approximately 6 or 7 years ago. And then Dysport was actually before Xeomin, and the newest one, Jeuveau, which is otherwise hashtag Newtox because it's the newest one now on the market. And if you look at all these names, they'll start with ONA botulinum toxin, Pro botulinum toxin, Inco botulinum toxin. Those are all botulinum toxins. They're all the active ingredient, and what works is botulinum toxin. Some of the proteins are a little bit different, and as a matter of fact, Xeomin is the only one that's considered a naked botulinum toxin. So for some patients, it works better than the other. For example, there's small nuances. For Dysport, it does spread a bit more, so I prefer that for male foreheads, that we have a larger area of the forehead that can be relaxed better with a product like Dysport. But Botox is still the go-to. In some patients, ideal world would be trying to have the injectables last about 6 months, so you end up needing to have it done twice a year as opposed to 3 or 4 times a year. And sometimes it means changing from Botox to Xeomin or Dysport or Jeuveau. You're in the process to see if we get that kind of a longevity. So each patient is different, and we're trying to do that. So what areas can we inject with the neurotoxins? I'm going to start with the bottom. We can start injecting the platysmal bands in the neck. We can inject the lips, perioral lines, chin we can inject. We can inject around the nose, the bunny lines, the glabella lines, which is the area that is actually the most commonly injected, around the crow's feet, and of course the forehead to be injected. Another areas that we can use it for is the jawline or the TMJ muscles. Some people have like fuller jawline. We'll show you some examples of that. And those areas can really be improved with Botox. I'm going to just use Botox generically because that's the one that we use the most often and everybody relates to the most. So this is a patient that we're going to talk about Botox. She at full angry look or repose, she has these deep lines. Obviously, aging has something to do with that, but it's also about kind of conveying a smile, a prettier, less angry face. And there's actually a study that showed it actually makes you feel better to have the Botox injections, not necessarily because you look better, but because the whole idea of when you smile, you actually feel better internally. Botox does the exact opposite of that, and just the muscle frowning is not there anymore, which is critical. It also can be used for headaches, and that's not a Botox cosmetic use. Actually, it's a Botox cosmetic, which is what I use, but neurologists use it, Botox, for different reasons, for actual headaches, and as a side effect, it might actually look better depending on where it's injected. So this is the masseter muscle. This is a patient similar off-label use that we're talking about. As you can see, she's very young, she's pretty, but she has more of a boxy lower part of her jaw. And by injecting Botox in that area, we can soften that up and make her look a lot better and prettier, more of a feminizing look there. Jeuveau, very similar, otherwise known as Neurotox, is the newest one that's available in the market right now. This is a patient on relaxed lines, looks better. And the other thing with all of these injectables is it's not about freezing the forehead. Most common thing that I hear from patients is, I don't want to be frozen. There are a few patients that do want to be frozen. I always tell them we can do it, but it's not my recommendation. In general, that frozen look is not a nice one. You want a nice natural reduction. You will still have animation. You'll be able to work and discuss and have, you need some anatomy to be able to convey messages facially, especially now that we have all faces covered. So we don't want to completely eliminate all lines, and it's about how it's injected to be able to show you that difference. Xeomin, similar to Botox injections, as you can see with her forehead raised, she has quite a few wrinkles, and then she doesn't after having it done. Now, the other thing that is interesting with the different neurotoxins is how quickly they take effect. For example, Dysport and Xeomin take effect probably about a day earlier than Botox does. One of the newest ones, Xeomin or Jeuveau, that's been started, actually is the fastest acting one. Doesn't mean necessarily that lasts longer for patients that have had it done, and each patient is individual. Some of them may last longer or other, but those are the things that we try to do in the office and basically tailor each injectable to each individual patient. Dysport is the one that has the most interesting dosing unit. The dosing unit for Dysport is a little bit different than Botox, than Xeomin, than Jeuveau, in that it's not 1-to-1, it's 3-to-1. And for that, your injector needs to be very advanced to be able to do that injection differently, and that's one of the things that I really like to do in men. So in men, I like it to spread more and get it to last a little bit longer for men, and that's what the main reason is that I use this for. And I'm going to talk about injectable fillers. Injectable fillers are in the category of bioactive, or ones that actually make your own body build collagen, and also kind of passive. And that passive variety is the most commonly ones used, and those are the Juvederms, the Restylans, the Versas, and those are the ones that you hear about the most. They're quite passive. They do not make your body significantly build collagen around where it's injected. They're just passively sitting in there, and they slowly get absorbed with what's called hyaluronidase, which is a normal enzyme that's found in everyone's body. And depending on where it's injected, that could last longer or less time. So I'm going to go through those different injections materials and kind of case studies of patients that have had them done. So where do we inject these? Some have on-label use, off-label use of different areas, but in general, forehead lines, brow lines, bunny lines around the nose itself for non-surgical rhinoplasty, cheeks, folds. Initially, when nasolabial folds were the only places that we got FDA approved for like Restylane, for example, which one of the first ones that came out. This is where we injected the most, but now we're injecting cheeks a lot, jawline, chin, and obviously elsewhere in the body, as indicated as an off-label use. We could have these fillers injected. So Juvederm from the Allergan family comes in different kind of thicknesses and different areas that we inject different thicknesses of products. Voluma, which is one, and that's the thickest one, we inject in the cheeks. Typically, I inject it in the jawline, in the mandibles, and that's the one that has a 2-year long-term result, which is the thickest one. From that, we go down to Ultra Plus, which is for an advanced injection. So somebody who's had multiple lip injections want to have the longest lasting result in injections for fillers in the lips. That's the Ultra Plus. Ultra is the kind of in between. Volura and Volbella are the thinnest but still long-lasting volumizers in the Juvederm family, and those are typically used in the nasolabial folds, lower eyelids. One of my favorites is Volbella in the lower eyelids, a half syringe, tiny little difference. We'll show you some of those examples for Juvederm. So I'm going to play a quick video of where we're having Volure and Volbella injected in lips. So you will see her before and after in a little bit coming up. Obviously, we don't do all of that as fast as it was shown, but the bottom line with this patient was the fact that we injected quite a few areas. She is young already, so this is not about making you look younger. It's about rejuvenating the areas that you have or enhancing those areas. So basically, she had her cheeks injected with Voluma. We also did some nasolabial folds, and that's velour and marionette lines. As you can see, it's much softer. Of course, we injected her lips and gave them some volume and more voluptuous, and she looks great. And a lot of these will last 6-8 months, quite a bit of a long time. Now, this is all hyaluronic acid so far. So we're going to talk about one of the advantages of hyaluronic acid, which is it is completely reversible if you want it reversed. Very rare that we have to use that, but it's a medication called hyaluronic acid that can be injected to melt the product away, similar to how your own body melts the product away. So we can advance that, and it's reversible for kind of a something to have in the back of your mind just in case you need it. One of the most common places that we inject fillers is velour or lower eyelids. So one of the things that can happen to somebody really young like her is, genetically speaking, she can have lower eyelids that make her look kind of like having bags in the lower eyelids, and that's not an aesthetic look. And having small amounts of velour or Volbella in this area is how we get to this kind of an after result. With a couple of days of swelling or very minimal bruising if that does happen. Of course, non-surgical rhinoplasty is another important aspect of injectables, and that's typically done with thicker injectables like Juvederm Ultra or Ultra Plus. And by shaping the nose and giving support to the tip, you can have about a year improvement in nasal contour without surgery, and that's a really nice option for patients that don't want to undergo a rhinoplasty surgically. Certainly lips, most common place that we use hyaluronic acid after nasolabial fillers is lips. This is a patient that wanted a full injection, Ultra Plus XC in her lips, nice pout and fuller lips that will last close to 8 months to a year. And that's a nice thing about Juvederm Ultra Plus. Restylane family was the market leader in hyaluronic acids, and Restylane initially came out as regular Restylane, and then followed by Restylane Silk. Restylane Lift, which used to be called Perlane, is the almost like an equivalent of Voluma that we can use in cheeks. Then there is Restylane Define and Refine with different cohesiveness, and the newest one, which is called Restylane Kiss, that was just FDA approved, and for lips, it has a nice double balance of having longevity at the same time, no lumps, and it's a nice smooth product, which is a really nice addition to the Restylane family. Also hyaluronic acids, also completely reversible. So this is a Restylane Silk patient having injected in around the lips. Restylane Silk was the go-to for lips before Kiss came out, and now I prefer Kiss over Silk because swelling and bruising is significantly less with Restylane Kiss than was with Restylane Silk. This is Restylane Lift to nasolabial folds and cheeks for this patient. As you can see, she is young already, but those deeper lines make her look a little bit older than she probably is. So it's better to soften those up gently and early on. Certainly can inject lips with Kiss, which is the nicest product for this area, appropriately named. And last results are 6 to 8 months, which is a really nice longevity for a product that is not thick at all. Then I'm going to define and refine are ones that I prefer for nasolabial folds, for perioral lines, similar to Velour and Volbella for in the Allergan family of hyaluronic acids. So occasionally and very rarely you have patients that are sensitive to some of these medications. So it's really nice for us to be able to have options. And in our office, basically, we have all the options that we talk about. Any injectable that's in the market right now, we have in our office. And it's something that I like to provide to patients so you have options so you're not kind of honed into one or two products. This is Define. As you can see, there's some what we call secondary smile lines around the mouth and the cheeks, and softening those up with small little injections will definitely help. Versa is not from the Allergan family, not from the Restylane family. It's its own thing, and it's the hyaluronic acid that is available for the pocket conscious. So it's the newest one that's out there besides Restylane Kiss, and the best thing about it is the fact that you don't have some big company that's behind it, and we're able to offer to patients that are price conscious. And this is a really nice option for lips, for nasolabial folds. It doesn't last as long as some of the other ones, but again, it's very individual. I've had patients that this lasted 8-9 months in. So it's we can always have this as an alternative for patients that want to try that. And that's a really nice product for lips, for nasolabial folds, for even cheeks. I particularly don't like it for lower eyelids though, because it's a little too thick for that area. So, and that's the option of having different injectables available for different areas. Radiesse is the first product that we are talking about in terms of injections that is not a hyaluronic acid. This is a calcium hydroxyapatite product, which is bioactive. So this is the first product that actually build your own collagen. So all these products that we kind of talk about that build your own collagen mean that they're going to last longer. So for longevity, these are really nice products. I know we have a picture of a hand which looks great in this area. It's actually an on-label use for Radiesse to inject it in hands. But the most common place that I inject Radiesse is actually your cheeks. So the malar area, one of my favorite things about Radiesse is the fact that the one syringe is 1.5 cc's, which kind of is like the perfect amount for most people's folds and nasolabial area. And that's one of my go-to injectables for cheeks. So it's a really nice product. It builds collagen. It's injected deeper so that you don't see it at all. It's kind of a white substance, so it needs to be injected a bit deeper. And it builds collagen, so lasts a long time. So it's very common that I start injecting this maybe once every other year or sometimes every 2 years. So it's a really good injectable for cheeks, hands, nasolabial folds. Not great for lips, not great for lower eyelids. Oh, great for nose. Non-surgical rhinoplasty is a really good option for people who have tried the hyaluronic acid and now want something that's a little bit longer lasting. Sculptra, here we have a picture of a bum, and Sculptra is a really good volumizer. The best thing about Sculptra is the fact that we can inject it in the cheeks, nasolabial folds, for somebody who needs a lot of volume. One vial of Sculptra could be 6 to 9 cc's, which is quite a bit. So it's part of the reason why we actually inject it in patients' bum or hip dips, because in volume, you need quite a bit of volume in that area. So the typical injection for Sculptra, which is again another bioactive which makes your own body build collagen, is an injection 2 months apart for 3 sessions. So you need about a 6 vial commitment to be able to get that kind of a result that lasts approximately 2 to 2.5 years. So it's long lasting because it builds collagen. You can inject it everywhere. I've injected in breasts, I've injected in buttocks. Certainly the most common area to inject it is cheeks, temporal area, and of course elsewhere in the body. The longest lasting injection that's out there, FDA approved, is one called Belafil. Belafil has a 5-year FDA shelf indication. That's indication for nasolabial folds, soft tissues of the face, and acne scars. It is made of polymethyl methacrylate, which is microscopic, tiny little plastic beads is what it is. It needs to be injected by a master injector, and it can cause nodules if you don't inject it right. So it's not for somebody who's just having injections done the first time. It's for somebody who's had multiple injections before. We need to actually test you for it, wait a month, make sure you're not allergic to it, and it gives you very long-lasting results, 5 years plus. And as far as I'm concerned, some of that actually is pretty permanent. I have it in my own face, so it's a nice product, injected deep, and you will not feel it, but it gives you really nice longevity. Carbella is another injectable category, and that's a category of fat resolvers. Carbella is one. Before Carbella, we had Lipostable, which is actually the active ingredient in Carbella. It's injections, a few sessions of injections, 4 to 6 weeks apart. FDA approved now for necklines and neck fullness. So we injected, like this patient, as you can see, her jawline and neckline has improved quite a bit in having these injection sessions done. Other areas that we injected is the bra roll in this area. It can be injected in the back of the arms. Can be injected in the thighs, inner thighs. For small areas of reduction, it's a really nice injection. It's not a surgical result, but it's a nice injection after about 3 sessions of having the procedure done. Another new area that I really like injecting Carbella is for people that don't have a whole lot of loose skin, but have a lower eyelid bulges. So the ones that have bulges, you don't necessarily want to camouflage by adding volume in that area. Now you're trying to remove some of that fat. So this is her after having 3 sessions of Carbella in her lower eyelids. It's kind of melt that little fat compartment. The nicest thing about Carbella is what's been removed is permanently gone. So you don't have to keep doing it. Once you get to the result that you like, you're done. That's been permanently reduced. So those fat cells are gone forever, and that's a really nice thing about Kaibo. ACell is an off-label use of a product which is a cellular matrix derived from pig cells that allow your own body to bring products like stem cells to the area that we want. We have it for PRP injections in the scalp. I occasionally inject it in the hip tips, like for the bum, like Sculptra that I showed you a picture of earlier. Also in small irregularities after liposuction or around the breast, where patient's own fat either is not available, or if it is available, it requires a trip to the operating room, and with ACell, that does not. So it's a really nice, long-lasting alternative for patients that don't have their own fat or want some magical results like this gentleman's hair. Thank you for joining us. Hopefully we answered some of the questions that you have. I know there's some answers here and on our Instagram Live as well. So Jackie, shoot with your questions so we can answer some of those questions that our audience have.
Sure. Okay. Thank you so much, Dr. Tehrani. So, yeah, like he said, if you guys want to write some questions in the chat, I can read them out loud and Dr. Tehrani can answer them. And then we also had some questions written in prior to the start of the webinar, so we can also run through those. So let's get into it. One person wrote they're interested in Botox for the TMJ. Can you speak to that?
Right, so the Botox for the TMJ is different than the masseter muscle, which is injected from the outside. The Botox for TMJ is an injection on the inside of the mouth, which relaxes what's called the pterygoid muscle, which is on the inside of the mouth, and it works really well. And the patients that have it done, some dentists even do it, benefit from it and may not need it more than twice a year. There are other non-cosmetic injections for Botox. Headaches we talked about, TMJ is one. Hyperhidrosis for excessive sweating is another one. I've done it for hyperhidrosis and the excessive sweating in the scalp, hands. There are many other non-cosmetic injection indications for it, but TMJ is a really good one. And as a matter of fact, we occasionally have patients in the office that are here for Botox in the forehead, and they're like, my jawline really hurts, or I clench my teeth a lot, and we give them one shot, and there just really is an amazing improvement in that area.
Oh, okay, that's cool. So a couple questions about like the under eye injections, the tear troughs. Is that safe to inject for in that area, or
it's a very safe area if you know the anatomy and how you do the injections. And we talked about this a little bit beforehand. It's not about the product necessarily, it's about the injector for the most part and how the area is being injected. And the products do help, and you don't want to, as I mentioned, you don't want to, for example, put Belafil in the tear trough, and that's going to be a bad thing regardless of who injects it. Having said that, I prefer tear trough injections being done very subtly, which means you have to do less, but a few more sessions until you get to where you want. And that typically means half a syringe. My favorite one in that area is Volbella, which is 0.5 cc's. And I inject that in the tear trough. And for some people, that's just enough after one session. Occasionally, you need a second session, which I do in about 2 to 3 weeks. And then that lasts a good 8 months to a year. And then we do some small touch-ups after that.
Okay, cool. So someone's asking, what's the best for a subtle eyebrow lift that kind of gives you that ponytail lift appearance?
Yeah, so that's done with a neurotoxin, and that's done with any of the neurotoxins that you mentioned, with Botox, with Xeomin, with Jeuveau, or Dysport. And that has to do with how it's injected. The way you inject Botox in the forehead is you telling the muscle, hey, you need to relax in this area. So if you differentially relax the midline and not relax the outside, it gives you a nice little tail. And that's the artistry of where you inject in the neuromodulator. And it can be done with any of those neuromodulators.
Okay, and that's the same for like a ponytail lift where you kind of just look like your whole forehead's lifted?
Correct.
Okay, that's great. Let's see what else we have here. So if you were to inject Kybella into the inner thighs, if you have very fat thighs, someone said, is that possible? How many maybe syringes would you need?
Yes, it's an area kind of, if you have like the rubbing area in between your thighs, that can be injected with Kybella. Depending on how much there is, you may need multiple sessions or multiple vials. I would assume if your thighs are rubbing, it's an area that you would have to have probably 2 vials injected, 3 sessions. So I would say starting point probably about 6 vials of Juvederm, of Kybella rather, but it's something that we really have to take a look at you virtually, and I will be able to give you exact recommendations.
Okay, great. And then actually someone on Instagram Live, they said about Kybella, do you recommend a surgical procedure over Kybella for the chin and the jawline or the injection?
It's a very common question. As a matter of fact, it's almost always that we give the patient a proposal for both options. One that would be a surgical option, which certainly has a downtime associated with it, but it's a one-time, one-and-done thing, whereas with Kybella, you have to do a few sessions. So it's really nice to be able to give the patient the option of doing either or, and understanding the pros and cons of with the surgical procedure, and which is typically done on the local anesthesia, so you don't even have to go to sleep for it. You may get some bruising, swelling, and maybe about 3 to 5 days of downtime, but then it's done, as opposed to with Kybella, which you get some swelling, can last a few days, and you have to do a few sessions of that.
Okay, great. Let's see what else we have here. Are there any new fillers and toxins coming out that you know of?
The newest one is KISS that we talked about. That's FDA approved. There is one that I'm really looking forward to seeing in the pipeline, and that's a neuromodulator that is not FDA approved yet, but it's supposed to last longer than all the ones that I just mentioned. The biggest problem with neuromodulators that we have now is some of them are kind of like a Me Too drug, which they do basically the same thing, and the only difference in them, their price point may be a little bit different, but they're not giving us that really long-term outcome, which is what's really been lacking in the neuromodulator market. And there is one that's promising that's hopefully be FDA approved.
Okay, that's exciting to look forward to. Let's see. Someone wrote in, what is the best for a droopy jawline?
That's very, very individual. I assume that you're talking about the pre-jowl, which is something that patients, is one of the earliest signs of aging of the lower face. And that typically, the very first time that I inject that area is typically with either Radiesse or hyaluronic acid. Depending on the age of the patient, if they're younger, I actually start with a bioactive like Radiesse, but for most patients, we start off with hyaluronic acid, like Juvederm or Ultra Plus XC.
Okay. So someone said, where could we find more information about injectables? I'm from from good and reliable sources for someone starting in the field.
The best thing to do is to go for either a virtual or in-person consultation with a core physician that's board-certified plastic surgeon. Expert injector is another place to look at, because the only people that become expert injectors are ones that are either core physicians, board-certified, or have worked for a board-certified plastic surgeon or dermatologist. So it's really important to look at that. And somebody in practice that offers all of the products that we just talked about and does quite a few of them. So it's important to look for that.
Right. And our website also, aristocratps.com, if you just want to read up on some of the injectables, we have different pages for that. So just check out our website if you want more information.
Thank you, Jackie.
You're welcome. And then someone actually asked, do you offer any courses for medical professionals for injectables? Or if not, do you recommend any specific courses?
I would love to have the time to do that, but unfortunately, we're very busy clinically and cannot do that. I also have my own fellowship, so the only way to get that kind of a training by me is to be part of my fellowship. There are actually quite a few courses that are available by different providers, nurses, plastic surgeons, dermatologists, and are very good. And I encourage taking many courses and kind of picking up little nuances on everyone. And because everybody does injections differently, and the expertise comes only by experience. And that, as you start doing it and finding out how some of the subtleties make a nice difference, is when you become an expert injector. So that's how I would recommend doing that.
Okay. So next question, are there laser facial treatments that would help promote facial collagen production, or would that harm injections?
Depending on the depth of where something was injected and the depth of the treatment, those actually can overlap. So for example, the lower eyelids is an area that's very thin. So if you want to have a resurfacing and you have that filler superficially injected, those will coincide. Same thing, very commonly patients want to come out in our office to have a laser procedure, like a laser facial done, and one Botox the same day. So we have to stagger that for them to have the Botox after their laser treatment, because if you have the laser right on top of Botox, the heat from the laser can actually inactivate the Botox that we just injected for you. So those are all very important questions that need to be individualized to the procedure that you haven't done.
Okay. And next question, does Bellafill absorb or will it stay in your skin for specifically acne scarring?
So Bellafill is that long-lasting polymethyl methacrylate that lasts a really long time. So the initial part, you get a bit of resorption, but what's there, even though it's FDA approved for 5 years, is permanent. That's what's amazing about it. They cannot, the company can't say permanent because for FDA approval you cannot show permanence, but they've shown 5-year results, which is pretty amazing. So for acne scars is wonderful. It's actually our go-to injection for acne.
Okay, cool. And I think this is maybe our last question. Can you address the canthoplasty option for the almond eye shape for younger people?
So that has to do with where you inject some fillers in that area. So some patients want to increase that angle, and by injecting hyaluronic acid, typically in that area, volbella or velour, you can slightly reshape that. There's a certain extent that you can go past, but for the most part, you can reshape that to the shape that you want.
Okay. Oh, we actually have a couple more on Instagram Live. So someone wrote, what is the downtime for a surgical jawline or like a chin lift, or if you use injectables for that area?
For injectables, there is a procedure called a Y lift where we actually extend the jawline really nicely, and that lasts about 2 years. Downtime about 5 days to a week. For the most part, the surgical ones have more downtime, which is about a week to 2 weeks. But again, best to talk about that with our virtual consultations. Thank you.
Okay, and then I guess this is something that we didn't really talk about. We have another question. Can you talk about maybe dissolving injections if they were bad injections or poorly done, specifically Voluma, someone asked on Instagram Live?
The biggest problem with dissolving injectables is knowing what was injected. If that injectable was a hyaluronic acid injectable, like, for example, Juvederm, Voluma, whether or not it was Restylane, Restylane Lift, if any of those were done, yes, you can inject it with hyaluronic acid or Hyalex. Another name for it is Vitrace. Again, something that we have in our office just in case it's necessary. And it's also necessary occasionally to do that in an injectable emergency. Thank God that happens very infrequently. We've had it maybe one time in our office where you get a vessel that gets occluded with a filler and you have to inject it to remove that. And you need to do that immediately. So all offices that do a lot of injections need to have that available. And of course, we have that in the office.
Oh, wow. Okay, that's great to know. And also, speaking of the eyes, instead of performing a blepharoplasty, what injectable could you use for a similar result?
So a lower blepharoplasty, if you don't have a lot of loose skin, can be done with velour or Volbella. For upper eyelid blepharoplasty with a brow lift or a chemical or neurotoxin brow lift, you can rejuvenate in that area. And sometimes we actually combine that with a resurfacing type laser, like laser resurfacing and filler at the same time for a non-surgical lift in that area. That's more for younger patients. If you have a lot of loose skin in that area, having filler in the area is not a good idea. It actually makes the area look more bulgy or full.
Okay, Great. I mean, I think it looks like those are the only questions, unless someone else has a couple more questions to write in the chat. It looks like that's about it.
Okay.
So for anyone who's interested in getting injectables, if you mention that you were on this webinar, we'll give you $50 off for your consult fee. And our offices, at least our Great Neck office, is open for elective procedures. Still waiting to know about our Manhattan office, but injectables we're up and running. So we hope to see you guys soon.
All right, thank you everyone, and thank you Jackie for putting it all together. Looking forward to seeing you virtually and in person.
Thank you.